Yeah, what do you do when you need progesterone but cannot tolerate it? I've taken the oral, vaginal, and rectal. These increase my anxiety, make me puke, and cause horrible dizziness. My levels are so low.
Yeah, so this is a tough one, and I go through this with some of my patients. So for the most part, progesterone is very well tolerated and people love it, but every now and then there is somebody who really just does not tolerate progesterone. And so normally, yes, normally it keeps us calm, helps us sleep, but sometimes it can make people more anxious and it can make people bloated. And that's the big thing that I see is that women, and again, it's fairly rare, but it's common enough to where I do see it here and there. Women will complain of getting bloated, of feeling too moody. And so you do need some progesterone to balance the estrogen, but you don't really need that much. So I will try to give just a very little bit of progesterone, like maybe 25 milligrams. We use sublingual tabs. So commercially you can only give what exists, right? And this is a problem with commercial drugs, like, because you can only give what there is, and like,
Mhm.
right? So with progesterone commercially, at least in America, so we have 100 and we have 200, and that's it. And they're capsules, so you can't break them, so you are just basically stuck with that. So we use compounded products, and what's great about the compounded products is you can make whatever you want. So
Mhm.
for the ladies that really don't tolerate progesterone, I'll do something like 25 milligrams of progesterone, like 10 days out of the month. And a really low dose like that seems to be all you need to really to balance out the estrogen, because to give unopposed estrogen, you can have too much proliferation of the uterine lining, and so you need some progesterone to balance it. But just giving a little bit generally works pretty well. And you can always work to see what, if you get the dose low enough, it will be tolerated.
Okay. Yeah, sure.
So yeah, and then you just have to find another way to work on the sleep, because that's a big thing. As us ladies get older, we stop sleeping. It's one of nature's ways of taking us out, and I've experienced that myself. I always slept really well until I was in my I think 44. All of a sudden, I stopped sleeping. I would sweat at night. Now I take my progesterone. I sleep. I'm dry. But if you don't tolerate the progesterone, melatonin, herbal supplements, cannabis, magnesium.
Mhm.
But you will be able to tolerate the progesterone if you give a low enough dose.
Yeah, great tips.